What's up guys, welcome back to this channel. Hi, my name is Linda and I'm a pharmacist, and in this channel we just do fun stuff and health stuff. So if you consider that as a good idea, please subscribe. And today I have a very special guest. He's a dancing Daktari, a TikTok dentist, and today we're gonna have fun. Yeah, so welcome. He can introduce himself.
Hi guys, whether I've always wanted to do this. Hi guys, welcome to her channel. Anyway, my name is Dr. Naph Macharia. Naph stands for Naphtali. Most people don't know that. And I'm happy to be here to give this talk with Dr. Linda. Yeah, let's see how this goes.
Okay, fine.
Yeah.
So today we're going to talk about something that is actually affecting so many people, and it's dental caries. If we dive straight into it, what are dental caries?
So dental caries is the most common non-communicable disease in the world at this moment.
Really?
Yeah, so usually I read, my paper said that 9 out of 10 adults have dental caries, and around 6 out of every 10 adolescents have dental caries. So you can see that's a very common,
it's
a very common disease in the world. Yeah. So what is dental caries? It's also commonly referred to as cavities, holes in the tooth. That's what people usually refer to dental caries as. It's a disease that's caused by a lot of factors. It's a multifactorial microbial disease. That means a lot of factors, and there's some bacteria and germs involved somewhere. Yeah, so there's bacteria involved, food involved, and time. You have to have time. You just don't get dental caries overnight.
Like ASAP,
it's not like you eat chocolate and then you get it immediately. Time is also one of the most common factors involved in that.
So now that we've seen the description and everything about like dental caries, let's look at what predisposes someone to having dental caries. So what actually causes someone to have this dental caries? As you said, it's a matter of time. Now take us through what really causes that.
So the number one factor, the most important factor that causes dental caries is carbohydrates, sugar. Anything that has carbohydrates, sugar, not proteins, not all these other vitamins, it's carbohydrates. They have sugar inside them. So so the fact that people who take a lot of carbohydrates and sugary foods are the ones that are highly predisposed to dental caries. Of course, there are so many other factors that can predispose to dental caries, like maybe poor oral hygiene, patients who don't brush their teeth oftenly, patients with fluorosis as well, because their teeth are usually destroyed. So they have a plaque and food substances and stuff, so they are also predisposed to dental caries. But the most important predisposing factors is high intake of sugary foods.
So some of those sugary foods, chocolates, sweets, everything. You people who have a sweet tooth, you see you're predisposing yourself.
Yes.
Now that we've seen what actually predisposes you to getting dental caries, let us now look at how now those factors turn into dental caries. So how does the process actually occur?
Okay, so remember when I talked about, I was defining what dental caries is, I talked about it being a multifactorial microbial disease, meaning there are germs that are involved. So there are two the mouth has a lot of germs, has more than
actually I was being told like if someone bites you can get a very
bad infection. That's true. So there's a lot of bacteria in the mouth, but the most important, actually two most important bacteria in the mouth, they're called Streptococcus mutans and Lactobacilli. Those two are the ones that now act on the food that's in the mouth, the carbohydrates. So what they do, they break down lactose, the sugar, lactose that's in carbohydrates. Lactose is a carbohydrate.
Carbohydrate.
So when you take a high lactose diet, that is anything, sweets, bread, all those things, these bacteria act on the sugar. They break it down. You get something called lactic acid.
You remember biology? Come on, biology, please go back and read.
So you get lactic acid. So lactic acid is very destructive to the tooth. So what it does, it demineralizes the inorganic part of tooth. That's the very hard, the enamel now. Okay.
So I can still remember.
You can still remember, So enamel is highly mineralized. So if you have an acid acting on it, it demineralizes it. So it becomes weak. Okay. And then a tooth also has organic parts. So the organic parts are destroyed. They become weak. So now you have weak enamel, weak organic parts, and that's now how a tooth gets a hole. There. So the enamel stops being hard anymore. So now you get a cavity. Then when you go to the dentist, you say niko na shimo daktari.
Niko na shimo, yeah. Which is usually very, very painful. Actually.
Yes.
Yeah.
Yes.
Now that we've talked about how it occurs, signs and symptoms, how do I know that I have a dental caries?
The most common symptom of dental caries is food packing somewhere in your tooth. So you eat something and you feel like it has stuck somewhere. Okay. So even before you start complaining of pain, you can sleep at night, sensitivity to hot and cold, you usually feel there's something that's sticking somewhere. You remove it with a toothpick or a floss and you feel something. Okay. That's the first most common symptom that patients present with. Number 2, you start getting sensitivity. Okay. So you brush your teeth in the morning.
It's very painful.
Yeah, you feel that. Have you ever gotten sensitivity, daktari?
A lot. We'll check after this, like, trust me. A lot.
Yeah, so now you get sensitivity to hot and cold. And then now you get pain. Pain. Yeah, so it comes when there's a breeze or something cold, you feel sharp pain.
Sharp pain.
Sawa. And then when the disease has progressed, you get even worse pain. So you can't sleep at night. It's bad. That's when now you remember, Naph Macharia, and you start calling him at 3 a.m.
At 3 a.m.
Yeah, and you refuse to go for the checkup at 6 months. Yeah, so that's what happens. So now you get very bad pain, and at that point is when most people come to the dentist. They really don't care when food is packing.
Yeah, when food is packing. It's true by the pain is what actually sends people to hospitals.
Yeah, that's true.
Yeah. So now we've looked at the signs and symptoms. Now let us look at how we manage it actually. Now you've come to Dr. Naph with your holes and everything. Now let us look at how he will actually take you through the procedure so that you become well.
Okay, so now there are different ways of managing dental caries. It depends with at what point you present with dental caries. So if you come early on, most of the time we usually do simple fillings. Let me use the most common term. People talk about refilling, but see refilling, that's very wrong. What are we refilling? It's a filling. We're doing a filling. Yeah, so what you do, you remove the area of the tooth that has the cavity, and then you clean around it, and then you put a material that looks like the tooth, that functions the same way the normal tooth would have. It's not as strong as a normal tooth. That's why you should take care of your teeth, but it equally does a good job. Because I usually tell all my patients when they ask me, hey daktari, you filled me, so how long will this last? I usually tell them it can drop right now, but because God is the one who created us, we just try to replicate him. We can't come as close.
Because I've had actually a few instances whereby I've had fillings, and in the next 1 month I have to go back. Yeah,
it happens a lot. So that's why you should take care of your teeth.
Spot on, you're trying to throw shade.
So that's what happens. So now the first common way, the easiest way is to do a filling. But let me go back and start with how we decide on how to treat dental caries. So a tooth has layers. Let's do an oral exam. Enamel, what else, doctor?
Dentine, cavity. My God, you're putting me on the spotlight.
Yes, those things now, So outside the tooth has enamel. Then there's dentine, and then there's the pulp. The pulp is the house of the tooth. I like to call it the house of the tooth. What does it contain inside that house? The nerve lives there. The blood vessels live there. So if you have a cavity that's limited to the outer 2 layers of the tooth, that's enamel and dentine, then you just do a filling. We call it a restoration, the technical term. We restore that tooth. So we just do a simple filling. So sometimes this cavity goes all the way to the house of the tooth, where the nerve is sleeping and where the blood vessels are. So that house has things called root canals. So you have roots that have canals inside. So we have root canals. So now when you have this cavity going all the way to the pulp, now we have to do another treatment. You can do a normal filling. So we do something called root canal therapy. So
that's where now the root canal comes in. That's now what we usually call just root canal.
Root canal. That's what people call the root canal. So why do you do root canal? Because now the nerve and the vessels are already infected. And there's no way to heal them without having to remove them now.
Okay.
So you make that tooth dead. It becomes non-vital.
Okay.
Yeah. So now that's when you do root canal treatment. So how do we know it's a root canal? One, the cavity has gone all the way to the pulp. You see this in a radiograph, guys, an X-ray. Yeah, we call them radiographs. Yeah. So the radiograph will show you that the cavity has gone all the way to the pulp.
Yeah.
Number two, if you tap that tooth, have you ever tapped your tooth?
Yeah. Then I always wonder why. Like,
yeah, so when you tap that tooth, the root at the bottom there usually has an infection if that cavity went to the nerve, because they are canals, they communicate. So there's an infection down there. So if you tap, the patient feels pain there. So that way you know, infection went all the way down there.
Okay. So if it's not painful, the infection has not yet
gone to the pulp there.
Okay.
Yeah, so that's at that point now, you just do a feeling.
Yes. Fine.
So now the point where then another most common symptom, even a patient you'll know, they didn't sleep at night. They have very bad pain at night. They can't sleep. They wake up at 3 a.m.
Yeah.
So what means is that you've ever woken up at 3 a.m. We are discussing you today.
It's like I'm on the spotlight today. It's fine.
Yeah, we're discussing you today. Sorry. Yeah, we'll check you after this. Yeah, so that's what happens. So you get very bad nocturnal pain at night, very bad severe pain, you can't sleep. That is because the pulp is infected, and then when you sleep, because most people lie like this, blood flows back to the head. So when you have an area that is infected and all this blood is coming there and creating pressure, you feel a lot of pain. That's why you can't sleep. So that's another symptom of a root canal needs to be done. So you do a root canal. Yeah, so a root canal is a topic I think we'll discuss another day. But it's also one of the ways of treating dental caries. Yeah, essentially, you kill the tooth, you make it non-vital, but you leave it in the mouth, and then you fill it, and someone can use it for as long as possible. Okay. There's one last mode of treatment of dental caries that we don't talk about a lot. We don't like doing it as dentists.
Why not?
Guess what it is? Removing teeth. So you can just, if it was dental care, you can just remove it. But the cost of replacing that tooth is very high. So we don't really recommend it. But there are instances where you have something we call gross caries. There is absolutely no way
you can
to save that tooth. Oh, prevention, yes. So first of all, being the most common and communicable disease in the world, knowing how it occurs, number one thing we do is to encourage reduction in the amount of sugar that you take.
So how much sugar should you take?
So I don't want to be the bad cop. I'd be like, don't take sweets, don't take chocolates, don't take cakes. So the worst thing is snacking. You see, say me, I take a lot of biscuits and you take a lot of biscuits, okay? But me, I take biscuits at 8 in the morning, no, at 7 in the morning, at 1 p.m. and at 8 in the evening, okay? And then you take biscuits at 7, at 8, at 10, at 1, at 3, at 4.
Frequency.
Yes, exactly. That's the word I was looking for. Frequency, yeah. The frequency is what matters, because a tooth takes time to demineralize, and then the body feels like, there's something happening here, so it tries to remineralize. So now every time you keep on giving it reasons to demineralize, it doesn't get to the point where it needs to remineralize by itself. So it continues to demineralize.
To demineralize now.
So now that frequency of taking sugar is the one that affects teeth a lot. So that's the one thing that people need to take care of. So now reduce taking a lot of sweets and snacking. Snacking is the worst. The people always have sweets in their pockets.
What hypoglycemia? We are guilty as charged.
So that frequency of snacking.
Only today you are talking about me, literally.
You're our subject. So that frequency of snacking is the worst. Is the one that causes you to get predisposes you to dental caries a lot. So you can reduce your sugary foods. That's the most important thing. Kabisa. If you can stop, because I want us to keep our teeth until people are 40, 50, 60, 70. Keep all your teeth. I see patients who are 55, who are 60, they don't have a single.
Oh really?
Even I know my grandmother doesn't mind. I treated my grandmother a few years ago. She has no cavity. She has no single cavity in her mouth.
Wow.
Not even one. Whoa. They didn't take sugar. They were taking yams,
Oh yeah, by the
sweet potatoes,
good old times.
all these things. Yeah. So the one thing she has is periodontal disease, which is a topic that we probably cover, and that is very important. So it's those sugars that we take. That is where the problem is.
Okay. Fine.
Yeah. But 2, you need to go to the dentist biannually. That sounds like it's a lot of times. Just 2 times in a year. Come in January, come in July, January, July. We do checkups. We just sit there, we check if there are any hole developing. You know, it just takes like 20 minutes. We take x-rays.
No, it's not like it takes a lot of time.
No, it doesn't take a lot of time to do a checkup. We take x-rays, we see there are no developing cavities. And then we just clean your teeth. So once we clean your teeth, we prevent cavities, and 2, we prevent periodontal disease, another very common non-communicable disease, and a disease that is very hard to treat. The last thing, you have to brush your teeth. It should have been the first thing,
Yeah, sure.
Yeah.
Prevention.
I assume you guys brush your teeth, because everyone brushes their teeth these days. No, because of mask, people maybe don't brush their teeth.
Are you sure people brush their teeth?
Ask me, I know.
In this cold weather?
Ask me, I know. I see them every day.
Okay, fine.
Yeah, so you have to brush your teeth.
How many times in a day?
How many times in a day?
Yeah.
How many times do you brush, Daktari?
Twice.
Religiously?
Yes,
We are in
religiously.
church.
Because
This
I
is
have...
a church
Yes. I'm not gonna lie. Religiously, twice a day.
That's
because
very
of
nice.
I have so many issues in my teeth, so I have.
So you started brushing twice a day after you developed those issues, eh? You see what we are
Spotlight.
talking about, eh?
Throwing a lot of shade, it's fine.
Yeah, so you have to brush twice a day.
Yeah.
You can brush 3-5 times a day if you want, but it's not
3-5
necessary.
times a day,
No,
really?
it's not necessary.
Yeah.
Twice a day, in the morning, after
meals.
meals. Eh? There are
To be
people.
after meals.
Yes. So the people who tell me, Daktari, I brush then I eat because I don't want the Colgate to remain in my mouth.
No, now let me tell you what I do. I wake up, I brush my teeth, I shower, I take breakfast, then I use mouthwash, then I go to work. So maybe that's why I'm
So you wake up,
suffering.
you do everything that you do, you eat first, shower, do whatever you have to do, and then brush your teeth.
Okay.
After brushing your teeth, now you can rinse with the mouthwash.
Okay.
Beware, you don't use mouthwash a lot, because the day you need a mouthwash,
I use that
those
every day.
bacteria
But I dilute.
will have you become used to that mouthwash. So as
Well,
long as you brush,
resistance.
yes, as long as you brush twice a day, you should be fine. After meals, guys, after meals, that's the most important thing.
Yeah.
Most people talk about brushing before meals because they don't want that taste to linger in their mouth. No, it should be after, because what happens now? Now you will eat. Remember we talked about sugars,
it's true.
so they will remain in the mouth. So now these bacteria will come and act on them, and then during that course of time you'll demineralize your tooth and you get your cavities.
So now I'm
and you'll come
actually
to
getting
dental, yeah.
I'm getting solutions to my dental issues,
Yes.
by the way, and that is so great. Thank you so much for that insight.
Another way of preventing dental caries. Remember when I was talking about going to the dentist biannually every year? So what we usually do, we clean. We take routine radiographs to check if there are any developing lesions. Lesions are just, the holes in your teeth. So there's something called fluoride that we apply biannually. And fluoride, what it does, it strengthens your teeth. In your teeth, you have something called hydroxyapatite. That's not I'm going into details, but this is how fluoride works. So fluoride comes in interaction with the hydroxyapatite to form fluorohydroxyapatite, that strengthens your tooth. But then when fluoride is too much, like example, places where they have a lot of fluoride in their water, you get something called fluorine when it's more than 2 parts per meter. 2 parts per million. So you get fluorosis. But then when you have the therapeutic fluoride and you measured, it strengthens your teeth a lot. So we apply fluoride as well. We have fluoride that we apply in the clinic, and then it strengthens your teeth over time, and it also reduces sensitivity.
Okay, so that's why most toothpaste usually have fluoride in it.
Yes.
Okay, now I get it.
Now you get it, yeah? That's why you should take the toothpaste that you buy, you make sure it has fluoride. Yeah. So guys, this is where I work. I'm pretty sure you've seen this on social media. We are doing a good job there. We are in Consolata Shrine. That's off Wayaki Way, inside the church. Not the church really, inside the church compound. They have an office park called Alamano Center. We are on 4th floor, suite 4A. yeah, that's why we do all the this is why we do all the magic. This is why we dance.
Yeah.
We're doing a TikTok after this. Okay.
Yes, we should.
Okay, I'll teach you how to do one. Yeah.
Bless your soul.
Yeah, and then now, yeah, technically come visit us. We have affordable prices. We do good service, and you'll enjoy your time with us.
Yeah, so guys, that's it. I'll also put all his social media accounts in the description below. Make sure you go and follow him. Make sure you go and just enjoy his dances because he's a great dancer. You'll see a video that she's going to teach me how to. We have to gas each other up. So yeah, and thank you so much guys for watching. If you have any questions regarding dental caries and anything, just let me know in the comment section. We'll be able to respond. Also, it's a pleasure to be here, and I'll just like kind of show you around. I show you how this place, like, it's so lovely guys. You should come and visit here. If you have all your dental issues, trust me, he's gonna solve them. So thank you so much, and I'll see you in my next video. Bye.
Bye.